Well, Ben and Jen, we still don't know the full scope of exactly what this will mean, but essentially it changes the way that the federal government responds to COVID-19, treating it as endemic. But with that comes the end of certain benefits that we've all gotten used to over the last few years. Nearly 3 years after the COVID-19 pandemic took over our daily lives, there is an end in sight to the national and public health emergencies.
It's good news. If you remember, in the midst of the pandemic, we thought we'll never hear these words that there's an end of the emergency.
President Joe Biden announced that he will end the emergencies on May 11th, and that means there are some changes that people will have to prepare for, including some out-of-pocket costs.
The testing is going to no longer be as easily accessible. The antivirals we'll have to pay for. So some of those things would cause some people to be concerned that, look, we don't have the support that the federal government was providing at that time.
While testing, treatment, and vaccinations will no longer be free, those with private insurance, Medicare or Medicaid, likely won't have to pay for all of it on their own.
We also need to know how much of this the insurance will be covering, because at times insurance doesn't cover, and that's somewhat of an unknown. So we want to make sure that the insurance companies would take care of the patients who will get the infection.
Making the changes a larger concern for those who are uninsured. For example, when it comes to vaccines, Pfizer announced it will charge $110 to $130 per dose, which means organizations here in Connecticut are already trying to get the word out.
They are using trusted messengers within the community so that we can understand what are the implications with the changes that are happening. Now that the emergency is going to be lifted.
Health Equity Solutions says similar to letting people know about testing or vaccines, that involves going into the most impacted communities.
We have to use different mechanisms. We've learned out from COVID. We can't just put things on the news. We can't just share things on the radio. We have to have information, and either it's coming from door to door, bringing it to our churches, bringing it to our barbershops, bringing it to our hair salons.
Now, one change that is happening even sooner, starting on April 1st, states will be able to start disenrolling people from Medicaid if they no longer qualify, and that could leave a lot of people without coverage. So advocates say that is an even larger concern. Live in Hartford, Gabby Molina, Fox 61 News.